Deep inside your extremities, a damaged nerve cell is misfiring, sending erratic electrical sparks through your body. You experience this physical reality directly. It's the persistent tingling in your hands, the deadening numbness in your feet, or a sudden, sharp burning sensation right under the skin. Faced with these symptoms, many people head to the pharmacy aisle and grab a standard B complex, assuming these products all serve the same medical purpose. But treating nerve vitamins as interchangeable is a mistake. Ignoring active nerve damage allows irreversible cellular degradation to set in over time. Taking a low-dose generic vitamin for a severe, progressing nerve issue wastes critical months of recovery time without providing the materials needed for cellular repair. To effectively address the problem, you need a structured, symptom-based escalation. We organize these options through the nerve repair ladder. The market separates into 3 tiers: Level 1 for general weakness, Level 2 for active tingling and numbness, and Level 3 for severe burning pain. You must diagnose the specific severity of your symptom before selecting the chemical tool, or you risk missing the target and allowing the damage to spread. We start at Level 1, targeting the mildest symptom profile, general body weakness and occasional fatigue. The most recognizable market standard for this baseline tier is Neurobion Forte. This formulation utilizes a broad-spectrum approach to vitamin delivery, packaging B1, B2, B3, B6, and B12 into a single daily dose. However, its critical limiting factor sits underneath the B12 label, a mathematically low dosage of just 15 micrograms. At exactly 15 micrograms, this dose effectively supports your baseline daily metabolism, but it falls well short of the concentrations required for clinical cellular repair. Neurobion Forte acts as a daily maintenance vitamin. It lacks the chemical threshold required to regenerate actively deteriorating nerves. If your symptoms escalate to persistent daily tingling, chronic numbness, or a clinically diagnosed B12 deficiency, you move to Level 2. This requires a significant chemical upgrade, a pure, high-dose methylcobalamin strip. Methylcobalamin is the active, immediately bioavailable form of vitamin B12. This chart visualizes the massive mathematical difference in dosage, a 15 microgram maintenance dose compared to a 1500 microgram clinical repair dose. This 1500 microgram dose shifts the body's focus from general metabolism to active nerve cell repair. This provides the precise building blocks required to physically regenerate the nerve's protective outer myelin sheath, restoring a smooth, conductive surface. While this dose successfully targets individual nerve cell regeneration, its single-vector approach lacks the secondary compounds necessary to fight severe burning nerve pain. Level 3 is defined by advanced, severe burning pain, typically associated with progressive conditions like diabetic neuropathy. The clinical option built specifically for this level of severity is Nurokind Plus RF. At this tier, the protocol shifts to a dense, complex combination therapy. This formulation aggressively stacks 4 distinct compounds: mecobalamin, alpha-lipoic acid, pyridoxine, and folic acid. This combination targets a distinct biological threat that drives Level 3 symptoms: oxidative stress. The addition of alpha-lipoic acid, or ALA, acts as a cellular shield, chemically neutralizing the oxidative stress actively attacking the nerve tissue. By reducing that oxidative stress, the ALA directly minimizes the severe burning sensations radiating through the feet and hands. However, utilizing these Level 3 formulations comes with inherent dangers and trade-offs. The long-term daily use of the high-dose pyridoxine, also known as B6, found in these combinations carries a paradoxical risk of causing secondary nerve toxicity. Nurokind Plus RF is an aggressive therapy that trades the risk of long-term chemical toxicity for the immediate pain control required in severe neuropathy. Reviewing this scorecard maps your symptom profile to the optimal clinical intervention. For general weakness, your profile pairs with the baseline maintenance of Neurobion Forte. For active tingling and numbness, use targeted 1500 microgram methylcobalamin. For severe burning pain, utilize the combination therapy of Nurokind Plus RF. Once you select your intervention, commit to a realistic clinical timeline. These nerve supplements require between 2 to 12 weeks of consistent daily use to show true symptomatic relief. Avoid the overkill trap. Escalating to a level 3 therapy to solve a minor level 1 problem wastes money and invites unnecessary chemical toxicity into your system. Finally, never use over-the-counter supplements to mask the deteriorating symptoms of serious undiagnosed conditions, like advanced diabetes. The fastest path to recovery requires perfectly matching the chemical tool to the